Hello, everyone, and welcome to the Drug and Alcohol Research and Innovation Active Learning Network, or Daria. We'll just wait a moment before we start in earnest. We are running a moment or two behind, but we just give everybody a minute to log in, and I'll just make sure all our attendees are attended before we start. We've got quite a number coming through. There's obviously a lot of interest in the topic here, and we're very lucky to have one of New South Wales's foremost toxicologists and addiction specialists to talk about it. So just bear with me a moment. We'll just wait until we've kind of maxed out on the attendees, which looks like we have. So before so thank you everybody once again for joining in to Daria today. We're very lucky to be joined by Dr. Darren Roberts, who is a physician who subspecialises in clinical pharmacology, addiction medicine and nephrology. It's a triple threat. Other training includes a PhD in clinical pharmacology and toxicology and a post-FRACP fellowships in clinical toxicology and nephrology and vasculitis at Cambridge. He's Medical Director of the New South Wales Poisons Information Centre, spa specialist in drug health at Sydney Local Health District, and Conjoint Associate Professor at University of New South Wales. So without any further ado, please welcome me in joining Darren.
Thanks, Chris, and thanks everyone for attending. It's really is a pleasure to be here to talk about this topic, which is certainly a very interesting topic, and a topic of which we've been learning lots about in a very short time. So I'm talking about poppy seed tea and Thebaine poisoning. I'd like to start with an acknowledgement of country. I acknowledge the traditional custodians of the land that I'm presenting from, and that is the Gadigal people of the Eora Nation. I pay my deepest respect to elders past, present and emerging. So just by way of overview, I'm going to remind you why we're all here today, talk a little bit about the use of poppy seeds in general, a bit more of a background about the biology of poppy plants and their contents, talk a bit about Thebaine, which may be a substance that many have not heard of, and we'll go through the clinical toxicology of that. Then we'll talk about our Australian experience with a cluster, which was only last month, weeks ago, of Thebaine toxicity, for which we're still gathering information and monitoring very carefully. We're going to talk a bit about the public health response, which included some community warnings. And I hope that we have time at the end so we can have some discussion around some of these aspects, because it's all a bit new and a bit fresh. And I think it's been a learning opportunity. So why are we here today? So on the 11th of September, New South Wales Health put out a community warning to the media and the community and everyone, saying that we're seeing severe reactions after people consuming poppy seeds. And that raised a whole lot of questions. You know, why was this put out? How bad is this effect, and who's at risk, and what should we do? So let's just step back a bit and talk a bit about the use of poppy seeds, because this is important when we're trying to understand and reflect on what this problem was and what we can do in response. So I think many of us are very familiar with the use of poppy seeds in baked goods. They're incorporated into a range of breads, muffins and cakes. In general, if we're trying to think about the amounts, and we'll talk about why amounts is important later when thinking risk, generally a cake that contains poppy seeds probably has about 2 tablespoons or less than 20 grams of poppy seeds, and that would be divided between 8 to 10 people. There are some cakes, such as what's shown there in the middle image, which are actually mostly based on poppy seeds. A very large amount, somewhere between 250 to 500 grams would be used to make that cake. But again, that cake would be used for a 16-person serving. So that would mean that most people would get maybe 15 to 30 grams of poppy seeds. But it should also be remembered that that style cake has a different method of preparation, whereby the poppy seeds are soaked in hot water or milk for about 24 hours, and then that liquid is drained and discarded. We'll talk about why that's important later. But all of these dishes are common and things that we come across regularly. So you can imagine talk about toxicity of poppy seeds raise a lot of questions with a lot of people. There's another activity or use of poppy seeds, and that is where food-grade poppy seeds have been used for drinking like a tea. This is where poppy seeds are for example, about 1 kilo may be dissolved or mixed up, not dissolved, in about 1 to 2 litres of water. And then usually the seeds are drained off and it's a liquid that's left which is consumed. We don't know how common it is that this occurs. We know it does happen. It's not, we don't think it's rare, but we have no real idea about the prevalence. Why are people doing this? Well, there's lots of different reported uses. Many of them are non-medical, meaning that it hasn't been prescribed by a healthcare practitioner, but often it's been used to self-treat what's probably medical conditions. There may also be some use to obtain the effects of the opiates that are contained within some poppy seeds, but not all. There is increasing data that shows that the consumption of poppy seed tea is not benign. Some people are at risk of dependence or an opiate use disorder. And there's also risks of opiate overdose related to this consumption. And this is all separate to the issues that we've seen related to Thebaine toxicity. A Turning Point, our colleagues and friends in Victoria have talk about this on their website, where they do a reflection on an individual called Sam, who was drinking poppy seed tea, and he started using it initially to self-treat a condition, and then as his use increased, he found himself using it more frequently. So he was using it to treat with pain after he'd had a tonsillectomy, and after using it for a number of weeks, he found that he was dependent on it. He found it difficult to get through his day, and it started to have all of the hallmarks of an opioid use disorder. And so this website talks about how people who drink poppy seed tea may need assistance for their opiate use. And there's been many other cases which have been reported in the literature describing this as occurring. There are other groups that are very concerned that poppy seed tea can kill you. This is a website which has been put together by, tragically, the parents of a young man who died. And they talk about their son, who at the age of 17 died because he'd been drinking poppy seed tea. One of the comments that they make on this, as you can see down below, is that there is in red text saying 125 times, is the marked variability in the content between different poppy seeds in terms of different opium alkaloids. And this is just showing a whole range of different poppy seed products in this one study, showing the variability between, for example, with morphine, 0.6 and 206 milligrams per kilo. So very wide variability in how much morphine someone may get from one of those products. And this is important because if someone's taking poppy seed tea, one dose may be low in morphine, one dose may be very high in morphine. And that's what happened in the case of the deceased, which prompted his parents to put this website up. This figure shows a range of different poppy seed products, the different sorts of opiates or alkaloids that may be found in there. And we can see morphine and codeine that are well known to us. These others we'll talk about later. And Thebaine is the topic of today. We can see that many places don't actually measure Thebaine, but again, there can be marked variability in the contents. So this website, I think, is really quite interesting. It makes it very clear that it contains morphine, as we can see here, and that this is a risk that most of us know. It also mentions about the added risk of taking it with other CNS depressants and how that may impact and increase the risk of death. And they make this clear point about the variability in morphine content, which is one of the reasons why this is such a risk. They go on and talk more about their son and his death, and that he'd been using poppy seed tea many times, and they're aware of this, and they felt that it was natural and maybe not as risky as some other substances. He consumed the usual amount of poppy seed tea, but it was a more potent batch. They talk about similar trends. And I think there's some really great and clear messaging about in the interests of harm minimization. Other action groups or lobby groups have also highlighted concerns related to poppy seeds more broadly. This relates to deaths, similar to the last presentation, dependence, such as we've already demonstrated that case study of Mark from Turning Point. But it also they raise the other issues, such as false positive urine drug screening. So they talk in their study about, or in their letter, about how women have gone into maternity, submitted a urine drug screen that came back positive for opiates, and all of the complications that are raised from that in terms of discussion over opiate use and the impact of that of being a parent. So poppy seeds have very mixed reception, and they're, I think, very relevant to all of us in terms of where we work and how we work. So let's step back a bit and talk a bit about the poppy plant. So the poppy plant, or Papaver somniferum, is been around for thousands. It's been known about for thousands of years. It's been used for the treatment of various sorts of medical ailments for thousands of years. It produces a latex, which when dried is what's known as opium. And opium contains a range of different substances. Morphine and codeine, which are well known to all of us. They've got opiate effects. Thebaine is what we're talking about today. It really doesn't have any opiate effects, and it causes seizures and strychnine-like effects in animals. And this relates to muscle cramps, which can be severe, associated with pain prior to the onset of seizures, which can be quite persistent. They're quite scary, but also characteristic, and often the person can feel that the seizure and the activity is coming on with increasing muscle symptoms before having a seizure, which is different to other seizure disorders where people can have a sudden onset of the seizure with minimal warning, certainly no minimal neuromuscular warnings. Contains other agents as well, such as narcotyline and noscapine, which are considered to be antitussives, but also anti-coughs, but also emetogenic. So it's not very helpful if it's stop coughing, but you start vomiting. Papaverine, which has been used as smooth muscle relaxant, and interesting laudanacine, which is a substance that's been known to lower the seizure threshold. And it's important to note this because there were some reports in the early days of people having laudanacine being measured. And so that was another possible contributor to the toxicity that we were seeing. A lot of these chemicals have slightly different similar structures. So we can see here morphine, codeine, and thebaine really look very similar with the three structures born, which are joined by an ester, in contrast to papaverine and noscapine, where you can see some similarities to see they're from the same plant, but they've got different structures which probably relate to their different effects. There's a lot of variability in the content of these different alkaloids depending on the poppy plant. So we've been talking about somniferum, which is the main one that's used for pharmaceuticals. We can see that morphine content can vary between 7.65 and 25%. Thebaine can be between 0.97 and 6.38%. Whereas this other Papaver species, which is sometimes difficult to differentiate when you look at them on their own, can have much lower amounts. These can also have seeds. Some people have advocated that we should instead be using seeds from this plant for food purposes rather than for others. Fortunately, there was a mutant variety of the poppy that was detected, which they called top 1, and that's based on the Thebaine or Ripavine poppy 1. And in this mutant variety, it's not genetically modified, it's a mutant. They noted that there was an arrest of the usual biosynthesis of these opiate alkaloids within the inside of that poppy, which caused them to be different in their contents to other poppies. And that is that they're extremely high in concentrations of thebaine and oripavine, particularly thebaine. And this is very useful because thebaine is a precursor for the manufacture of drugs such as buprenorphine, but also oxycodone. And this is the main poppy that we see being used in Tasmania. And it's one of the reasons why Tasmania grows over 40% of the world's illicit opiates, mostly based on the thebaine poppy. Those of you who like these sorts of mechanistic stuff, what we've learned is that thebaine is the precursor, and then through different pathways, it either goes to ripavine that then forms morphine, or thebaine goes this way to form codeine that forms morphine. And in the top 1 variety, these two processes are halted, and so thebaine and ripavine are the two that feature particularly highly in those poppies that we see in Tasmania. So what do we know about Thebaine? So Thebaine-rich poppies are used, as mentioned, for the production of illicit opiates, particularly buprenorphine. And the producers that are in Australia, France and Spain particularly use these Thebaine-rich poppies for that reason. So what do we know about Thebaine toxicity? So we've already mentioned that it has these strychnine-like effects, which can include seizures. We don't really know how that works. We think it may relate to either antagonism of glycine or maybe GABA effects. There's been some talk about it having opiate effects, which is probably unlikely, and we're out of time to go into that, but it's probably unlikely. There's also some reports that it inhibits cholinesterase, but again, we don't see a clinical syndrome that's consistent with the cholinesterase inhibition, such as organophosphate poisoning. So that's probably also unlikely. It's a highly toxic compound. If we look at animal LD50s, so this is the LD50 is the dose that will kill 50% of an animal population, that the dose of Thebaine required to achieve that number, it's a very grim number, I'm sorry to have to talk about that, is much lower than that of morphine. So it's a very potent substance, which means that a relatively small amount can cause toxicity. Interestingly, monkeys who are given it over about a month, once they stop taking it, get some sort of withdrawal phenomenon. So we don't really know what that is the mechanism of that. But what we do know is that in those animals, they don't get tolerance to the seizure effects. That just seems to occur anyway. What do we know about it from animal data? There's only one study I could find where they gave it to animals, where they looked to measure what's called the pharmacokinetics. And they gave 5 milligrams per kilo, and we saw a maximum concentration of 1 milligram per litre, which can help us to understand more about how it's distributed around the body. It's got a very short half-life, 1.1 hours. So that would mean that about 5 hours after someone had taken Thebaine, an animal had been exposed to Thebaine, it was largely gone from the body. It's extensively metabolized, including they could measure codeine, and only about 17% of that dose is excreted in the urine after 96 hours. It's very lipid soluble, 8 times that of morphine, which means that we get into the brain much faster, distribute around the body. It doesn't persist in the brain. And when they gave this dose of 5 milligrams per kilo, they didn't see that this had any effects to the animals. And instead, 20 milligrams per kilo is normally the dose that's more likely to cause toxicity. So that may make us think that 1 milligram per litre is a safe concentration, but that's only in animals, and animals aren't humans. We can use this to make an estimate of the volume of distribution in animals, which can then help us to understand roughly how much an animal would need to take to have it come to risk. And there'd be questions as to whether or not we could use that for humans. For example, how many poppy seeds would cause problems and cause them to have the seizures. Just in case you like graphs, this is showing similar information for the concentration of Thebaine. This is the concentration of Thebaine here and time post-injection dropping very rapidly. But interestingly, we do see over time that the concentration of metabolites increase. And what we aren't exactly certain of is whether or not these metabolites themselves have some activity themselves. So although Thebaine looks like it's going away, there may still be some other toxicity from those metabolites. This study looked at Thebaine and how it's broken down in mice, and these are the metabolites that it was measuring, which can relate to a combination of codeine and even morphine, although the amount of morphine that they found is extremely low. But look, that's rats. What do we know about humans? There's been a number of research projects looking to understand about Thebaine in humans and how it behaves. This relates to a few things. For example, urine drug screens. I mentioned before about the action group that was looking to restrict how much opiates were found in poppy seeds because of false positives with urine drug screens. Well, we've all come across patients who's got a false positive, who's got a urine drug screen that's positive for opiates, and they might report to us that they hadn't actually taken any opiates in a period of time before that test. So we might find ourselves asking, well, what is the source of this opiates? And that may relate to eating poppy seeds. And so if Thebaine is present, it's generally considered that the person had taken it from, had been exposed to that from a poppy seed rather than from another opiate. That's fairly unreliable because there's a whole lot of poppy seeds that don't contain Thebaine, but that's one of the areas of research that's been performed. There's also been some studies with human volunteers. And again, this relates to that same purpose of understanding about the impact of urine drug screening and the measurement of Thebaine. And that's where they gave them baked goods, which they just purchased from a store. And then they looked at how Thebaine changes in their body. And they only looked at urine concentrations. They didn't have any blood concentrations. But generally, we see that Thebaine is coming into the urine within about an hour. It peaks within about 4 hours, and then it steadily decreases. And it can actually be present for at least 24 hours in many people, but in others, more than 36 hours. So there's a lot of interpatient variability. This is much longer than what we've been seeing from the rat data, where the half-life was much shorter. Here's a graph. It shows two different dishes which they were provided with. One was a strudel and one was a bagel. And note that these are all volunteers who are eating a baked good, which included a regular amount of poppy seeds, so none of them had toxicity. And we can see relatively high concentrations, up to 80 milligrams per litre, for example, of Thebaine in the urine, and it persists for a longish period of time, much longer than what we've seen from the animal studies. What else do we know about human data and how toxic Thebaine might be? There's a few reports in the literature of people who have died where they've measured the Thebaine concentration. This report from Martinez in 2016 was where a 32-year-old man, he had a history of epilepsy, was found dead in a poppy field. He had broken into this poppy field and ingested an unknown amount of poppy capsules, which contained the opium. He had some friends with him who said that he had a seizure that persisted for 30 minutes without stopping, and he was dead, unfortunately, after that. They measured the concentration of Thebaine is 0.1 milligram per litre, which is much lower than we saw in the mice, but the rats, but again, that's rats, not humans. And the concentration in the urine was 7.12 milligrams per litre, which is really very low. That's down here compared to what we've seen in volunteers eating the product. So they didn't have much data to go on, and they said Thebaine and his history of epilepsy may have contributed to that poisoning. But we also do see concentrations of morphine and codeine. It wasn't just the Thebaine that contributed to that. There was another report of a patient who, a 42-year-old man who was found dead at home. He had a history of substance use disorder, including alcohol. And there was evidence that he'd been having poppy pods to make a tea, but he also used a benzodiazepine. And he was found dead, unfortunately. And then he had a blood sample which showed a low concentration of Thebaine, 0.07 milligrams per litre, so much lower than some of those concentrations seen in the humans and in their urine. Tragically, and closer to home, there's been reports in Tasmania of people who have broken into poppy fields and stolen poppies. And there's two reports mentioned in this Tasmanian police report by people who were found dead because they were taking the Thebaine poppies. They were unaware of the actual intrinsic toxicity of those poppies and tragically used them and died. And so this is a media release from the Tasmanian police. Unfortunately, no results reported there. So Thebaine is present in humans. Just because it's present doesn't mean it's causing a problem. When people are taking poppies, they're taking a whole lot of substances, and all of these substances can have differing effects on the human and the person and their risk. Moving to a different topic now relates to how stable is Thebaine? Is there any way that we can inactivate it? So some studies were published from only 2 years ago, and they noted that in this one, if you place poppy seeds on a baking tray and you cook it at high temperatures, you get faster inactivation. So this is the concentration of Thebaine with time. If you cook it at 200 degrees Celsius on a tray, within 15 minutes, most of the Thebaine has disappeared. 180 degrees, it's also similarly gone that quickly. But if you're cooking it at, say, 120 degrees, then it doesn't change very much. This is just showing two different batches. If we contrast that to other treatments, this is steam treatment where the poppy seeds were placed above a steaming mechanism for 30 minutes. We can see here, looking at Thebaine, that there's no real change. So that as a treatment doesn't change the amount of Thebaine. And if we wash it for 5 minutes, that's just in cold water, then there is a decrease in the content of the poppy seeds. And that means that that Thebaine has gone into the water. And so if someone was to be consuming it as a tea, which is often where they mix it around for varying times in water, then the amount that's been washed off those poppy seeds is then available to be consumed in the drink. Similarly, if you were making a cake and you washed it for a period of time, it would be the amount that was remaining here that would then put the person at risk. So washing poppy seeds, particularly for longer, will be more likely to reduce the amount of toxicity. If you consume the poppy seeds, that's as part of being in a baked good. In the same study, they looked at it in the stability in baked goods. So they incorporated it into a muffin. And this is just showing, again, different products. But what we can see is, looking at Thebaine, there's no change if you cook it in a muffin for 15 minutes. And this is because the temperature inside the muffin doesn't really get above 100 degrees. So just because something's being cooked in a muffin, that doesn't mean that it's removed. So thinking about Thebaine and toxicology, what are the conclusions? I think rats are not humans. What we've learned from rats is different to what we see in humans, and that Thebaine is more persistent in humans. And that means it's got a potential to accumulate. So if a rat had a repeat dose 5 hours after the first one, there's probably a low risk of accumulation. But in a human, it means that they'll get more Thebaine that will then accumulate in their body. There's marked interpatient variability. So how I might be at risk of Thebaine toxicity is different to how you might be at risk of Thebaine toxicity, and we don't know how to describe that. So some people are going to be more at risk than others, and we don't know what those patient factors are at the moment. What we think is happening from certainly with animal studies, and we would guess that humans are the same, is there's dose-dependent toxicity. The more you have, the more at risk you are. But just because Thebaine is present, it doesn't mean that it's causing toxicity. And we have minimal human blood data to be able to inform us in terms of what is a toxic concentration and what is not. So when someone has taken poppy seeds and there's Thebaine present, it's difficult for us to say that concentration says that that person has had these effects due to Thebaine. And treatments in cooking has variable effects at inactivating Thebaine, and it depends on the temperature, the duration, and method of cooking. So probably the main reason why a lot of you are here, and I think that's important to give that background to understand how we interpret what happened in November of 2022. So ultimately what happened was a clinical toxicologist in Queensland noticed a cluster. This is Associate Professor Kath Izawade, who's the Medical Director of the Queensland Poisons Centre and an emergency specialist. And on the Monday, the 7th of November, she noted that in the previous week, she'd had 3 cases coming into hospital. All of these people had purchased poppy seeds as a tea in a supermarket, and they'd made poppy seeds and they'd made them up into a tea. And she noted that these patients had neuromuscular excitation. So they had muscle pain and rigidity. Some felt dizzy. Some had rhabdomyolysis or muscle injury. Many had seizures, and one of them actually had an out-of-hospital cardiac arrest, and they were in critically ill condition in intensive care. And so she shared this on a discussion group that we have amongst the poison centres, just to say, hey, I've seen this. Are you guys seeing this? And this prompted us all to go and look at our data and talk amongst ourselves. And by the end of that day, New South Wales, Victoria, and Western Australia had all identified cases of the same manifestations in people who had poppy seed tea. And so we started hypothesizing, what has happened? Is there a contaminant in this poppy seed that people are buying from supermarkets? Or are they an unusual poppy seed and then they've got a higher content of the neurotoxic alkaloids, such as the Thebaine and the ribavine that I've already mentioned? So Kath introduced a series of steps. She referred to a local public health unit. They arranged testing of seeds and the tea where available. And remembering that these assays for Thebaine are not widely available and up and running, it requires some effort of the scientists to put together the assay and make sure it's working properly to be able to give results. And that doesn't happen immediately. They look for blood samples that are available in patients and started testing them. And they made referrals to their various food safety and environmental health branches to start other investigations. Other services in other states, such as New South Wales, followed similar processes. And because it was mentioned at the time, certain brands that were available, This then led to investigations into the company that packages those poppy seeds. And that company was based in Victoria, and therefore Victorian Health led that process. The next day, New South Wales at this point had found at least 8 possible cases. Queensland laboratory results are starting to come back with some preliminary information in 4 of their cases that had blood tests on, and they said, we think that there's Thebaine in there. They weren't certain because this was a preliminary finding on the assay, but that's what they were wondering. And so that same day, Queensland issued an alert, which wasn't to the general public, it was to risk populations and services that may interact with this target population, that the use as a tea of poppy seeds and the presence of Thebaine, and that this may cause toxicity. Already there was a lot of discussion within chat groups which are interested in substance use, for example, Reddit. Report at this point was showing that severe toxicity was being noted from poppy seeds amounts from as low as 120 grams or up to 1 kilo, where people consume that liquid. Here's a picture of the release that went out, which was essentially showed the same information that I already presented to you, and what to do if you have any effects. 000 if it's an emergency department calling the Poisons Centre. So the next day, New South Wales issues an alert to healthcare workers. And in that we said we're suspicious for Thebaine. In other words, you can't extrapolate from regular poppy seeds when you're making this assessment. Regular poppy seeds and opiate contents, we think this is a neurotoxic compound called Thebaine. On the 11th of November, we also issued one to GPs. And then later on that day, we decided after a lot of discussion that it was necessary that the entire community needs to be aware about this problem. And so we released an alert, one of those fun things, late on a Friday afternoon, where we said preliminary investigation suggests high levels of a naturally occurring chemical that needs to be well cooked to be destroyed. Victoria issues a general health alert that day, saying when brewed in a concentrated form, such as a tea, and that they are suspicious for Thebaine. So you can see there's some differences in some of the messaging. So for example, Victoria and Queensland spoke specifically about consuming poppy seeds as a tea and mentioned Thebaine. In New South Wales, we spoke more about consumption as a drink rather than popularising or potentially popularising the use as a tea. And we spoke about, we didn't want to say specifically about Thebaine because really at that point we were really dealing with very preliminary information that hadn't been actually provided to us formally, given that the early investigations were being conducted by other states. And we tried to reassure people that consumers of baked good is probably okay, because we haven't had any problems with that. It needs to be well cooked to be destroyed, which relates to some of the data that I showed you before about well cooking it in an oven, which isn't the same as well cooking it in a muffin. And the same information, please come to the hospital if you have any issues. And so that was on a weekend. Over the weekend, sorry, that was on Friday afternoon. Over the weekend, various sorts of environmental health and Department of Primary Industry individuals, officers worked very hard to do investigations. And by Monday the 14th, it was identified that they could confirm now that non-food grade poppy seeds had entered the supply market. And that same day, a trade level recall was enacted. So that's where the recall and the information about the food recall is initiated to the companies only, not to the general public. But they commenced the process for a product recall. And then the next day, the Food Safety of Australia and New Zealand issues a nationwide recall. And for the first time, the names of implicated brands are listed. So the overall health outcomes related to this cluster was that as of today, we've had 41 cases across Australia, including 15 cases in New South Wales. And the last reported case was on the 21st of November, and that was in New South Wales. All reported cases occurred after people consumed poppy seeds as part of a drink, similar to a brewed tea. The onset was generally within 4 hours, usually sooner, 1, 2, 3 hours. If you haven't had effects by 4 hours, it's unlikely that you would. And there was no reports of people being poisoned after eating any poppy seeds and any baked goods. Most people who became unwell had consumed more than 100 grams of poppy seeds or washings, which is about 11 tablespoons of poppy seeds. The lowest amount we're aware of was around 50 grams, which caused poisoning. But we did have a case of a person who obviously decided to continue using their poppy seed tea because at the time they weren't aware whether or not it was a toxic poppy seed or not. And they had multiple small doses during the day. And it was on their third dose, they then became sick and had seizures. And that probably relates to the accumulation of Thebaine in their blood until it reached a critical concentration, which causes effects. Most of these patients required hospital admission. Tragically, I'm only aware of one death. I hope that's the only death, but this is very tragic. And I'm aware of one case who has persistent kidney failure, which is requiring dialysis. Since this outbreak, we've been contacted about cases in 2 other countries. One of which was in Canada, which is still under investigation. Another one from a country which cannot be revealed at the moment because it's still a legal investigation. So there is some questions as to whether or not this was limited to Australia or not. And with time, we'll see. So what caused this cluster? Let's look back and understand what happened. And it related to the fact that poppy seeds with a high Thebaine content incorrectly entered the food supply in around September 2022. And it just took 2 months until they reached the shelves. These poppy seeds are not food grade. This was the media release that came out with the national recall of the poppy seeds, which spoke about how the poppy seeds have been recalled because they're non-food grade. People are directed to the website to find out about what products they are. And we've essentially said at this point that new information means they should not be consumed in any amount. This is a website which by FSANZ, Food Standards Australia New Zealand, which lists particular products. So this was not limited to just one product. There were multiple products which were impacted by this issue. And some fairly blunt and clear messaging regarding, for example, the Hoyts brand is shown here, and some of the risks. So I think there's a number of very interesting features of the investigations. And first of all, this was very much a multi-state response. The number of cases in each state was relatively small. Everyone was having different experiences at different times and had different resources that could be mobilized at different times. And it really was, I felt, as being part of that, representing toxicology in New South Wales, that people worked very well together and communicated very well together and shared ideas. And I feel that it went well, but we're still doing a lot of reflection and discussion about what went well and what maybe could have done better. We needed multi-agency cooperation, and this is due to so many people and so many services which were impacted by this cluster. That includes people like me who work in toxicology because of the acute overdose risk, and we needed to work out how do we communicate to healthcare workers about this issue. In New South Wales, it became a reportable condition. So if a healthcare worker was to come across a person who had this poisoning, they needed to report it to the government so that we could then chase up that case, get clear information about what happened, do blood testing so we can then better understand how to inform and advise others to prevent more cases. Analytical scientific services worked extremely hard to develop assays that weren't routine at that point so that we can measure bloods samples, but also the products to get a clear idea that what they've taken is what's caused the issue. Food safety had many inspections and other processes and spoke to suppliers. But there was also a lot of reflection on those who are chronically using poppy seed tea based on either their risk of withdrawal, if they can discontinue. For example, people who take it daily, we know there's been dependence. I've already shown you cases of that. But if they then stop consuming poppy seeds because of the risk, will they then go into withdrawal? And how can we support those people? And other interested community groups that we really reached out to engage in the discussions about the risks to improve communication. And many of these activities were not led by people, by what I do, toxicology, or what I do of drug and alcohol. It was led by different health agencies who had their processes and their systems to run. So back to the community warnings. As mentioned, that was our community warning. This community warning generated quite a bit of controversy. I felt it was quite a bit of controversy, but maybe it wasn't. Certainly there's a lot of discussion in certain public circles. And some of this related to, for example, were we too vague? What is a large amount? Is a large amount a tablespoon? Is a large amount 100 grams, 500 grams, 1 kilo? And how well defined is that? What is well cooked? We mentioned in that release that if it's well cooked, you should have a low risk, and that was based on data that if it's well cooked at 200 degrees Celsius, it's all gone. That doesn't mean if it's well cooked in a muffin that there's no risk. And so this caused some confusion. Would a clear statement stating that Thebaine is in the poppy seeds of reduced use and reduced risk, would that have made it clearer to people? Again, I heard informally that some people's initial interpretation of this community warning was that maybe it was a more potent batch, had more morphine. And so some people had then started still trying to use the poppy seed tea, but taking small amounts, thinking that they could manage a high concentration of morphine, not realizing that the high amount of Thebaine means that you won't get any opiate effects, you're just at risk of toxicity. And then there was a question as, does it give false reassurance to eating baked goods? For example, I mentioned at the beginning that some cakes contain maybe 40 grams of poppy seeds per slice. Is that enough to cause toxicity? So finishing up soon. So just in terms of reflections, what are my reflections on this? I think this has identified an issue that in toxicology and poison centres we've been talking about for a while, and that is we need urgently an automated systematic process for detecting toxic risks. This toxic risk was identified mostly of the poppy seeds was mostly because a clinician who works in a service whereby she's aware of most of the cases that are coming through. She noted that there were 3 cases that were very atypical. If we compare that to across New South Wales, where these patients can be coming into multiple hospitals and multiple systems seen by multiple doctors, and even calls to the Poison Centre, which has 30 or more people working, we often get uncertainty in history and information which is provided to us when people call. And so it is possible that, so we can't always respond to just a single report. So a process needs to be put in place whereby we can see trends early, so we can have then a prompt response as has occurred within this poppy seed tea issue. I think the cooperation of multiple agencies to define the issue is really very interesting. As mentioned, we had clinicians, public health experts, scientists, food safety, agriculture, food people. It was all very multi and interdisciplinary. And so I think it was also really important that we had systems in place so that we could communicate, and that systems were sufficiently flexible that we could talk about preliminary information in an informal manner so that everyone was up to date rather than waiting for formal finalised results to come through, so that we were in a position to be more agile and responsive to information and questions as they come forward. I think public messaging was very interesting, and I think we can reflect more on that. Do we talk about uncertainty? Do we talk about incomplete information? Do we delay messaging until it's more clear, until the facts are clear? think ultimately people will criticize or praise each of those different approaches. But as we all know, harm minimization is key, and I'm very much a fan of, let's say, something at an early stage so that people are aware and they can start reflecting, and then we provide updated information. It was also an interesting time in terms of considering how we support at-risk people. People drinking poppy seed tea appear to be doing this at a regular basis. Everyone who's poisoned, to my knowledge, had done this before. They were familiar and practiced with the procedure, and then the poisoning occurred despite that awareness. And to me, this relates to the fact that it's a practice that they're regularly engaging in. And so that means we need to be there to support those individuals in terms of information, so they're aware and can make decisions, but also to be ready to support them if they have issues with withdrawal. So this is my acknowledgement slide, and this is really just acknowledgements for people who contributed to a lot of this work. And my apologies, I haven't been able to get their permission to be listed. So if they don't agree and their name's up there, that's not because they've signed off on my talk. But these are all the people, just some of the many people who contributed to this overall response within New South Wales. Up there foremost, I think, is the PRIZE program, Prescription Recreational Substance Evaluation Program, which is funded by New South Wales Health for toxicity surveillance and response, who really was the action arm of a lot of sort of the toxicological and investigative components, as well as some of the messaging to the Ministry of Health, as well as the Centre for Alcohol and Other Drug colleagues, the Poisons Information Centre, Health Protection and FAS, New South Wales Users and AIDS Association, DPI, and of course Kathy Zawadi, and many interstate colleagues who did so much hard work to help put together the story that we're still analysing and trying to understand. Thank you.
Darren, thank you very much. That's a really wonderful overview of the Thebaine and poppy seeds, and really, I mean, there's so much we could unpack here, and it is just great to go back to the chemistry and everything as well. There's lots of questions, so I won't linger too long then, but I wanted to ask one: have there been any reports so far of people having withdrawal or issues as a consequence of this product recall or anything like that?
Not that I'm aware of. Not all poppy seeds have been removed from the shelves, only certain poppy seed batches. So there are still some poppy seeds. I think it's actually been a great opportunity, though, I think, to raise in everyone's mind the fact that people are doing this, because I think it then facilitates discussion that someone can approach healthcare providers if required to seek information about what sort of services and support are available.
No worries. Next question: is it cheaper to produce Thebaine derivative semi-synthetic opioids such as oxycodone and buprenorphine from poppies rather than opiates, heroin and morphine?
Sorry, say that again.
Sorry, the question: is it cheaper to produce Thebaine derivative semi-synthetic opioids, so cheaper to produce oxycodone or buprenorphine from poppies than it is to, I think the question is asking, to produce opiates?
Yeah, I'm not sure. I mean, I think the reason for Thebaine is it's easier to produce them from Thebaine than it is to produce them from morphine or codeine, if that's what the question was. It's just a single step, and that's why Thebaine's used. But I don't know anything about the actual cost.
If I may also just ask, just so I've got it clear in my head, it sounds like the tea process, because it is at a lower temperature, also makes a difference as well in the process. Is that correct? As in part of the reason this has become a problem?
The poppy seed tea?
Yeah, the poppy seed tea, yeah.
So the other thing to remember is that there's a whole wide variety of ways in which people prepare poppy seed tea. So some people put in hot water or coolish water of different temperatures for different periods of time before draining the liquid out and consuming the liquid. Some people have been adding other chemicals as well, because in the community, there may be said that if you add lemon juice or something else, then that may help to bring out those substances. So there's lots of different methods by which people prepare poppy seed tea. I'm not sure of how much more effective some of those methods are.
I think a follow-up just to the question a moment ago was the question about why don't we just stick with opiates? Do we even need to have the semi-synthetics? I would say we definitely need to have buprenorphine. We don't need to necessarily have that, which is a full synthetic. I don't know about the semi-synthetics. I don't know if you've got an opinion on that, Darren.
I personally don't really have strong opinions. I mean, we need Thebaine. So buprenorphine, we know, is so useful for people who have problems with opiates. And so I think anything that allows us to have access to buprenorphine is good.
There was another question. What mechanisms are there to communicate concerns internationally? So I guess that's the, yeah.
It's a great question. So it's a matter of, so we, certainly within toxicology circles, we are linked in with toxicology networks throughout the world, which we can easily send messages to. The last I heard, but this was, again, all preliminary information, I haven't heard the final decision, but when the investigations were looking into this non-food grade poppies entering the market, at that time it was thought that the poppies seeds that had entered did not leave Australia. And so it was actually anticipated that particular issue didn't leave Australia. These other cases may relate to people sourcing poppy seeds from elsewhere. As mentioned, it's not only Tasmania where these poppy seeds come from. And in the current case, it's not even yet clear where these poppy seeds came from. They weren't necessarily local. I'm not saying they're from Tasmania. There's other places that have high Thebaine content poppy seeds. So certainly from our perspective, we're very keen to publish this in peer-reviewed journals. Myself, Kath Isaward and Jared Brown wrote an article in The Conversation, which has a fairly good uptake in terms of across the world, where if people were to Google, they can come up and see what our experience were. And it's had 20,000 readers since I last looked. I don't know if that's a lot or not, but about 20% of those are from the US. So I think Google's very powerful.
Absolutely. Good insight. What was I going to say?
Or TikTok if you're a younger person.
Yeah, true. I'd love to see you in a TikTok video about this. I'm interested. What is this? Do you know? I mean, this is going a little bit left field, but what is the security like at these poppy seed sort of plantations? I mean, I have visions of cartoon style, like Homer Simpson diving into a vat full of Duff beer, sort of this person who breaks in and starts eating poppy seeds. Is that what it's like?
I have no idea. I would imagine that the security was very good, but I guess that's part of the reason why the police on that Tasmania media release I showed you were actively saying to people, do not go in there. They've just got high amounts of Thebaine. This will just kill you.
Yeah.
But I don't know about elsewhere where they've got a higher opium content.
I'm fascinated to know and where they are and everything else. There's a sort of follow-up question to that. I'm doing questions a bit out of order here, but are there any indications of how these seeds entered the food product, of how they got into the market? It's
not known to me. I think that is still under investigation and reporting. As you can imagine, it's quite sensitive, so I'm sure it will come out in time. But it's not something I'm aware of. I'm sorry.
Then I guess this is a good place to ask this question. Do you think they might do any more media releases at this stage?
Well, we haven't had any more cases. The problematic substances have been recalled. I'm not sure what new information we've got to share at the moment, but if anything comes out, happy to do so. And if anyone who's here for the talk thinks that there's something that's glaringly hasn't been covered, please let us know and we're happy to assist sharing that.
What was I going to say? What came first, the Reddit post or the Queensland toxicologist observation of the cluster of 3 people?
Very much the Queensland's observation. And then from there, the discussion started. And then the discussion then led to the Reddit post. It's interesting, actually, so if I may, the Reddit post is quite interesting because it started talking about how some of the people who had this effect felt that the seeds had a slightly different color and a slightly different taste. which I think is always interesting when reporting that based on a few cases. And I'm not certain how reliable that is and if that can give false reassurance to some people rather than others. But as mentioned, it's extremely early days at that point. We were uncertain if we should be sharing that information, for example, in New South Wales.
Sorry, I missed that point there, Darren.
Oh, we were uncertain if in New South Wales we should be sharing that information
about
possibly lighter colour or different taste, in case that would give false reassurance to some people.
Then I guess that's a nice place to go to the next question, which is, do you think there needs to be messaging on the labelling that alerts people to Thebaine toxicity?
With regular poppy seeds?
I assume they're talking about regular poppy seeds. So does there need to perhaps be something like, if the person who's written this question, if I have this wrong, I assume they're asking about messaging on the labeling. I'm assuming they're talking about like on packets of poppy seeds. If I have that wrong, anonymous attendee, please to post. But I assume that's what they're saying. Do we need to warn people when they purchase sort of, your over the counter, if you, I mean, you can, as you said, you can go into Coles and Woolies and buy some today if you want. Yeah,
look, I think this is I'm not going to brand endorse certain supermarkets, Chris. No, I'm joking. I tried
not to. I said one, and I thought I'd better say the other, and then poor old IGA got forgotten about.
I know. Look, I think it's raised a whole lot of really interesting things about poppy seeds. There are some variants of poppy seeds which contain very little opiates, and so the question is, should we be using those? And in which case that will impact on people using poppy seed and making the tea. Overall, Thebaine content in regular poppy seed should be exceedingly low, as shown in those volunteer studies where they ate just a regular bagel and muffin or something. I can't remember what the other thing was, strudel. They had Thebaine concentrations that were apparently high, but they don't cause toxicity. They weren't high enough to be a problem. So personally, I don't think we need warnings against Thebaine. This was a one-off issue, as far as I'm aware, where non-food grade poppy seeds incorrectly entered the market. It's not a baseline risk of using poppy seeds, but there are opiates in poppy seeds, and I think it does raise other questions in terms of whether or not we use particular varieties of poppy seeds which are lower in opiates.
Well, this follows on. You're almost predicting the next question, Darren, each time, because is it possible, since the over-the-counter codeine ban in chemists, people have started looking for other ways to access opiates such as poppy tea?
Look, maybe. I don't know. I'd be guessing. We don't know how often it is that people are accessing or using poppy seed. We don't know the indications, as shown in that website, poppyseedtea.com. The parents weren't aware of actually what the contents are. There was an interview with one of the patients on a major radio TV station where he advocated for the use of poppy seed tea shared his own experiences of poppy seed tea to treat a gut problem. It's possible lots of people are using poppy seed tea for lots of different reasons, and they may have varying degrees of awareness and understanding about the risks of that. So I'd be surprised if it relates to codeine, but I'm just guessing. But I think it does raise, yeah.
Well, if I might then ask the last question, which I suspect will be the last question, can we? And I'm not a baker, so I don't eat a lot of poppy seed goods, I have to be honest. And I now can't eat gluten, so it'll be even less.
Sorry.
Can you pre-prepare them? I mean, is this a possibility that they could, that at the production stage they get pre-cooked and then this is a non-issue, or is that ruining the entire process of having delicious poppy seeds?
I'm also not familiar with that. I mean, as we've seen, if you wash poppy seeds, you will remove a certain amount of the content, and only a 5-minute wash in cold water can drop it by nearly 50%. So there must be ways which preparations can be done, but I'm not sure how they impact on safety. I showed you that recipe where it uses a large amount of poppy seeds because it's a dish based on poppy seeds from Eastern Europe, which has up to 500 grams of poppy seeds, but that's soaked in hot water or milk overnight, and then the liquid is drained off. So that would be a way of which the preparation would decrease the amount that's in there, but We're already seeing, though, from the information that's out there, that there's such wide variability in morphine content that a 50% decrease in a highly potent form might still be a high amount. And so it goes back to, our usual advice that we give to people who are using substances, particularly if it's from a new supply, about start low, go slow, be very careful, and have people around you.
If you're going to indulge in orange and poppy seed cake this weekend, start low. No, I'm joking. And I missed this comment from Chris de Siegfried, who did say the Prompt Response Network had 2 incidental meetings the week when this was first discovered, and given the diversity of the stakeholders in that group, be interesting to see how that complements the future strategies around public health focused meetings and mitigate some of the criticisms, communicating with consumer focused NGOs to help understand what the limitations are that contributed to info released. And so forth and so forth. And look, obviously, there's everybody's very hyper aware about public health messaging in the wake of the COVID crisis as well.
I completely agree with Chris's comments there, and we're learning all the time. This is a new experience for a lot of us, where as mentioned, early information's coming out. It looks like it's from food. How do we communicate that? What do we communicate? And I think all mechanisms of communication are valuable. And I think as we do more reflections and unpacking of this whole cluster, I think those sorts of reflections and inputs and advice by specialist groups such as PRN will be invaluable.
Oh, sorry, last one, promise. How do you alert people to the risks and where to seek help?
The risks of Thebaine toxicity.
Yes, I assume that's what they're asking particularly about.
If I understand correctly, so we've attempted to promote it through the media, promote it in general circles. There's been specific targeting of information to at-risk groups, however defined, and there's a whole, for example, there's a network. The name leaves me at the moment, which relates specifically to how community groups of people who use substances in whichever form, for whatever reason, are all connected. And so there's been a lot of messaging through that. Multimodal, multi-pronged approaches to messaging, I think, is important. But ultimately, if someone needs more information, I think there is enough now on Google and the internet. If you need to find it, you're welcome to read our conversation paper, which we think goes through enough information. But if anyone has any symptoms, they just call Poisons Centre 13 11 26, where they can be assessed across the phone for the potential link and if it's important. But as usual, if it's a medical emergency, just dial 000 and get straight to a hospital, because people can die and have persisting toxicity.
Darren, thank you very much for your time. I imagine you've got people bashing down the door to have your time and expertise on this topic. And so we greatly appreciate that you were able to share some of your insights here on what is a fascinating, series of events, and one that, as you say, has a lot of, we'll have some questions that need to be answered well into the future. So thank you again for your time today.
It's very much a team effort. This is not all me. This is very much a team effort.
Excellent. The politician in you. Wonderful.
No, I am team. Okay.
Thanks so much.
Thanks a lot, Chris.
Bye.
Thanks, everyone.